Dhanush Infotech is a global IT and healthcare services organization headquartered in Hyderabad, India, with offices in Africa and Australia and operations in more than 30 countries across the globe. Dhanush has the honor of working with prestigious entities like Ministry of Health and Family Welfare, Government of India, Government of Andhra Pradesh, Government of Uttar Pradesh, United Nations, JPAGO, and the Government of Kenya for execution of the various prestigious primary healthcare programs across India and Africa. Dhanush has developed a comprehensive suite of integrated healthcare solutions covering all the public healthcare institutions, starting with ASHA workers and ANMs with Anmol, auxiliary nurse and midwife online solution. Anmol is a tablet-based mobile mother and child healthcare monitoring solution which is conceptualized, designed, developed, being rolled out along with suitable training to the ANMs and supported by Dhanush across various states in India. Anmol aims at identification and tracking high-risk pregnancies by ANMs, regularly monitoring the healthcare parameters of pregnant women using Anmol solution. Anmol provides help to ANMs for collecting data related to 5 phases of mother and child well-being, which are identification of eligible couple, pregnancy, antenatal care, postnatal care, childbirth till child attains the age of 5 years, including vaccination. Anmol has the outreach features included for helping the ASHA workers with ASHA module. Anmol includes medical officer module for teleconsultation with a medical doctor. Anmol is rolled out in close to 20,000 locations in states like Andhra Pradesh, Telangana, Madhya Pradesh, Haryana and Odisha, out of 200,000 plus locations to be rolled out across the country. With more than 150,000 sub-centers across the country, sub-centers form the basic building blocks of public healthcare ecosystem in India. Dhanush Sub-Center solution has the features for creating the electronic health record, specialist consultation through telemedicine, integration with drug vending machines, screening and outreach camps. Dhanush Sub-Center solution has been extended to include the Ayush medical consulting and alternative medicine dispensing feature in alignment with the vision of Niti Aayog to convert the sub-centers as wellness centers for promoting holistic health. Dhanush solution is currently being rolled out in the 40 sub-centers in the tribal and rural regions of Rampachodavaram, Paderu and Parvatipuram of Andhra Pradesh by providing quality medical services. Dhanush also facilitates NCD, non-communicable disease screening services at sub-centers to screen the prevalence of NCDs like hypertension, diabetes, obesity, and advise the patients on the next steps. As an extension to e-sub-center solution, Dhanush has developed ePHC solution for provisioning of quality healthcare services at PHC level, wherein a patient registered at sub-center can directly avail the healthcare services at PHC with the availability of electronic health record. Dhanush is successfully managing 58 urban primary health centers of Andhra Pradesh in 4 districts of Andhra Pradesh by providing end-to-end medical services supported by latest telemedicine technology. EUPHC is an electronic urban primary health center which caters to healthcare needs of the urban poor population by making essential primary healthcare services available to them and reducing their out-of-pocket expenditures for treatment. Operations of health centers are carried out with the help of software, equipment like CCTV cameras to capture patients for claws, biometric devices to capture and play attendance and patient record information on daily basis, computers and printers. Patients come to the telemedicine center for the first, will be getting registered in the system by a telemedicine coordinator by capturing patients' personal and demographic information and generating unique identifier number for the patient. Nurse or ANM talks to the patient to select his or her record in the system and asks his or her chief complaints, and also asks about history such as any allergy to food or medicine, medical history, and capturing immunization history of children into the system. Nurse checks the blood pressure of the patient along with other vitals such as temperature, height and weight, and records them in patient's electronic clinical record. Patients will be sitting in waiting area unless their turn comes for doctor consultation. Posters on child immunization or sanitation, etc. are there to educate the patients on health. Basic amenities like air conditioning rooms, drinking water, toilets, etc. are provided in centers. The doctor will do the general assessment after viewing the clinical data entered by the nurse and physical examination for evaluating objective anatomic findings through the use of observation, palpation, percussion, and auscultation. These findings and patient's medical history aids in determining the diagnosis and devising a treatment plan. If needed, doctor calls specialist doctor for consultation of patient through teleconsultation solution. Specialist doctor can also review the clinical record of the patient and ask the doctor at center regarding the patient condition and sees the patient through teleconsultation and asks the patient about his or her problem, and after assessment of patient will suggest the treatment and instructions to the patient directly and updates plan of care in the system. Plan of care includes diagnosis, investigations, drugs, and instructions. Lab technicians collect the sample of patient specimen and do the necessary tests suggested by doctor. Lab technician using analyzers will test the sample and get the results and analyze results to verify them. Those reports are sent to doctor for his interpretation on patient's condition electronically through telemedicine solution. Patients go to pharmacists to get the drugs that have been prescribed by the doctor. Patient will collect the plan of care with diagnostics and prescription summary report from the telemedicine coordinator at registration desk. EUPHC solution is a single window solution for all medical services, which include diagnostics and specialist doctor consultation and medicine dispensation with effective usage of digital integrated platform. In similar lines with Andhra Pradesh EUPHC concept, Dhanush has established and is running 12 digital clinics in Lucknow, Allahabad and Gorakhpur of Uttar Pradesh. These EUPHC, which are fully transformed into most modern primary healthcare clinics, are supported by the Dhanush solution, medical equipment, processes, training to the staff along with monitoring dashboard on the status of EUPHC operations.
पहले से अब बहुत ज़्यादा अंतर है, अब हर चीज़ की सुविधा है यहाँ पे। अब बहुत ज़्यादा अंतर मिला, बहुत अच्छा हो गया है।
नए जमाने के हिसाब से ये हॉस्पिटल जो डेवलप हो रहा है, ये हमारे हिसाब से बहुत अच्छा एक पहल है, क्योंकि पेशेंट्स जो है ना, वो चाहते हैं कि हमें अच्छी सुविधा मिले। पेशेंट्स आर वेरी हैप्पी कि मेरा बहुत अच्छे से इलाज हो रहा है एंड दिस हॉस्पिटल हैज डेवलप्ड अ वेरी गुड हॉस्पिटल।
इस प्रकार के हम लोग ने 2-3 पायलट प्रोजेक्ट शुरू करे हैं लखनऊ में, जो कि प्राथमिक स्वास्थ्य केंद्र है और उसको ई स्वास्थ्य केंद्र बना रहे हैं, नागरिक स्वास्थ्य केंद्र बना रहे हैं, प्राथमिक स्वास्थ्य केंद्र बना रहे हैं। ये हम हमारा प्लान है कि हम पूरे उत्तर प्रदेश में फेज वाइज इसको लेके जाएंगे और लोग जो गरीब हैं उनको भी लगना चाहिए कि उनका भी इलाज कोई अच्छे 5 स्टार अस्पताल की तरह हो रहा है।
Model district concept is being implemented in the Sitapur district of UP with the support of Bill and Melinda Gates Foundation, with an aim to attain a significant reduction in mother mortality rate and infant mortality rate and improve patient satisfaction towards public health services. RMNCH plus A indicators of public health services are tracked in real time and monitored with the help of a Dhanush solution. Dhanush indicator monitoring system tracks very vital parameters of public primary health care related to institutional delivery, out-of-pocket expenditure, OPD improvement, and many more. Government of Uttar Pradesh is planning to roll out this model district concept across all the districts in Uttar Pradesh. Dhanush has been providing Rashtriya Bal Swasthya Karyakram (RBSK) healthcare screening for 0 to 18-year-old children across the state of Andhra Pradesh, covering 8 million target population twice a year. The screening services included under RBSK program managed by Dhanush are to screen and detect the health conditions related to 4Ds, which are defects at birth, diseases in children, deficiency conditions, developmental delays and disabilities, with the help of mobile health team and referral management at the specified public health institutions. The RBSK clinical services of Dhanush include performing diagnostic tests, dispensing drugs, and monitoring referral services to nearest public healthcare centers, including District Early Intervention Centers, DEICs. Dhanush is conducting RBSK screening services in AP using 450 mobile health teams, wherein each mobile health team consists of one male and one female doctor and 2 ANMs and 1 driver. Dhanush has developed and implemented Hospital Information Management System, HIMS, for provisioning of quality healthcare services at CHC or district hospital level. HIMS solution includes patient registration, doctor consultation, patient management, operation theatre management, laboratory, nursing station, billing, pharmacy, and other specialities to enhance the performance of day-to-day operations of the hospital. As part of corporate social responsibility, Dhanush has set up the digital clinics with an intention of providing the quality medical care at affordable costs. At Dhanush Digital Clinics, the services provided are the same as EU PHCs. Dhanush Digital Clinics are established in semi-urban areas like Rashtriya Vidya Kendra, Ghatkesar in Telangana, and in tribal region like Matham in Paderu region of Andhra Pradesh. Dhanush, with vast global experience of working in developing economies across the world, has developed comprehensive integrated digital healthcare platform, which caters to the healthcare service delivery across the value chain of the public healthcare ecosystem. Dhanush solution digitizes the health record of a citizen and stores in the form of longitudinal health record, or LHR. Patients visiting public health institutions where LHR model is implemented can access the past and present electronic health record either at ASHA or ANM, E-Subcenter, E-PHC, ECHC, or up to E-District Hospital. This integrated healthcare platform, services and solutions are fully aligned with Niti Aayog recommended and centrally sponsored Ayushman Bharat, National Health Protection Mission, and Universal Health Mission of Sustainable Development Goals of the United Nations. Stability, completeness, conformation to global standards, portability, ease of rollout, and simple maintenance are the main features that make Dhanush Healthcare Solutions the need of the hour for the Indian public healthcare system to meet the digital India health vision of our